Welcome back. This is Good Morning Namibia. When we think of our health, we often focus on eating well, exercising, and managing stress. But how often do we think about our gums? Research continues to reveal that the health of your mouth is closely tied to the health of your entire body. Today we're joined by Dr. Ishumael Banda, a dental surgeon at Wholesome Dental Practice, to help us understand the deeper impact of gum disease and how taking care of your gums could be protecting your heart, your brain, and even your unborn child. Good morning, doctor, and welcome back to Good Morning Namibia.
Good morning to our Namibian viewers, and also good morning to our international viewers, since we are now on air on all our social media platforms.
Thank you so much for that very comprehensive greeting, doctor. How have you been?
I've been doing very well. Thank you so much once more again. It's always a pleasure to be here.
The pleasure is always ours to have you.
Thank you.
In basic terms, doctor, help us understand the correlation between the well-being of one's gums and your overall wellness. What is the correlation?
The correlation, I think you started a bit deeper than where I thought we would start before we get into the deeper, more serious stuff.
Yes, I jumped the gun.
Yeah, exactly.
My sincere apologies,
but
doctor.
it's okay.
Yeah,
I think the correlationship between naturally your oral health and also your general body health, I think there is so much research and so much compelling evidence that we cannot ignore the interlink between the two. I will also hasten to talk about the gum disease vis-a-vis with also your general body health. It has been done, actually a lot of research has been done, and it has been seen that people who are suffering from gum disease are prone actually to cardiovascular problems, and they are at a higher risk also to develop heart attack, your stroke. And not only that, also they are also at risk to develop also other like respiratory conditions. You see your chronic obstructive respiratory disease and the pneumonia. The inflammation actually and the inflammation of your gums, those bacteria, they can spread into, you can aspirate them, then into your lungs, and you can then either cause your pneumonia or it can exacerbate somebody who is suffering from pneumonia already. And also it has been shown through studies and research that mothers that are pregnant, they are at a higher risk actually to have preterm babies. And also the babies that they give, normally they are low weight babies at birth weight. Yeah, exactly. And the other thing also, cancers, some of them, there's still not so much research in that area, but there is also a compelling evidence to show that some cancers might be actually linked to your gum disease. Yeah, these are some of the things that we can talk about. And in a nutshell, we always say the mouth is the window, the gateway to your general body health. Yeah.
So it would make sense, even to a layperson, why there indeed is a correlation between oral health and your holistic physical health.
Yes.
Yeah.
Yeah.
I think it's important also, doctor, to perhaps take an even slighter step backwards from that point. Speak to us about what constitutes gum disease and what ordinarily gives rise to gum disease.
Yes, that's where we should have started. Anyway, we are going back and we are starting before we'll end. Yeah, what normally causes gum disease is what we call a plaque. Yeah, this is a sticky film of bacteria that normally collects around your teeth. And if you don't brush or clean it, it actually hardens to form tartar. And the gum disease, basically, they can be classified into two stages. We have what we call gingivitis. Gingivitis, this is fortunately a milder form and can easily be reversed by instituting good oral hygiene and also through professional dental cleanings. Then if not treated, it can actually then become a serious condition which we call periodontitis. It's just a big name, but it means it's a severe form of what? Gum disease, where you find the infection has gone below your gum line. Then your gums become detached, like they become loose, and they form pockets where infection can collect and pass, if it's an active infection, they can be passed around your teeth. And your teeth then become loose, and eventually you might end up losing your teeth.
Apart from poor oral hygiene, what else could give rise to the onset of either the initial infection but also the more serious condition?
Yeah, I think dietary dietary consideration. If you are indulging in these sugary, sticky, fizzy drinks and food stuff, because the bacteria, they actually are eating on those bacteria, and it's an environment where the bacteria, they can thrive and then they can multiply and then therefore cause the infection. Then the other things, tobacco and the tobacco related products. Chewing tobacco, smoking can be actually something that is not good. And also you talked about lifestyle stress. Stress, it weakens one's immune system and makes you prone to infection. And the gum disease being one of the disease, it also can predispose you to be infected with gum disease. Yes.
How prevalent is it? How often do you see it in practice?
Yeah, that's a very good one. Actually, gum disease, gingivitis, they say is the most prevalent condition after your flu. Yeah, because everyone at any given point in time, you have your bleeding gums. Because that's a sign of gum disease, especially gingivitis. Your gums are bleeding, swelling, or they bleed easily on brushing, or sometimes spontaneously. That should tell you actually that we are suffering from gum disease. So it's very, 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 very prevalent. Yes.
At what stage would you intervene by also proposing that your patient goes to see another medical professional on account of what you are observing clinically as a dental surgeon?
Or the other health conditions.
Yes.
Yeah, exactly. Actually, since we have seen that there is compelling evidence to link the two.
Yes.
So when you visit your dentist, we do at least see what we should do and manage within the expertise of being an oral health expert. But we work in hand, depending on also your medical conditions, your general medical condition. We can therefore then refer to other medical experts.
Because you'd be able to, based on your clinical observation,
exactly,
flag
Yeah.
that something else could possibly be wrong.
There might be something wrong, yeah.
Yeah.
Yes.
What is it that we need to do to protect our gums and through that protect our overall physical health, doctor?
Yes. So we always talk about this and we say you need to make sure you visit your oral health expert at least twice a year. And also you should avoid indulging in these things that are actually predisposing one to suffer from gum disease or periodontal disease. Yeah, like your sugary food stuff should cut down, and you need also to come for nutritional counseling so that we can actually educate you, give you oral health education on how you should take care of your oral hygiene needs and how you should brush. And not only that, what one should do. Then the other thing also, you need to make sure for those that are suffering from other medical conditions like diabetes, because diabetes also, there is a bi-directional relationship between the gum disease and your diabetes. Yeah, diabetes actually it predisposes you to suffer from what? From gum disease. And if you are suffering from gum disease, you find it hard actually to manage your sugar levels. So all these things, we need to make sure that you come for early diagnosis, treatment, and prevention plan. Yeah, that's what is needed.
When a patient visits you with full-blown periodontitis, am I pronouncing that tongue twister correctly?
Exactly.
Yeah. What interventions do you then give them in your practice?
Yeah, when one is suffering from full-blown periodontitis, you
have to say it carefully and strategically.
Yeah, exactly. Yeah,
Very
so
well.
that everyone can get it nicely, and including my interviewer here.
Very well.
Yeah, exactly. Yeah. So we make sure that we are able to diagnose, to treat, and treatment always goes with the maintenance preventative plan. Yeah, that's what we normally do. And sometimes if it's full-blown, like you are saying, the teeth are loose, and sometimes you find it's very hard actually to do anything to save them. So there is no other option except to try and just remove and do the rehabilitation, where you can now think of either putting your bridge or your crowns, or not your crowns, but your implants and dentures, to try and replace and rehabilitate and maintain your oral health, aesthetics, and your functionality. Yeah, this is what we normally do. But in severe cases, we can also actually refer to specialists, which are called periodontists. Yes.
Do we have a wealth of such specialists in this country?
Not really, but I think we might have one. Not as many, but we might have one, if not two, with the whole of Namibia.
Earlier, you shared with us, Doctor, that it's next to the flu. It's the most prevalent condition.
Yes.
Right. Do you observe the onset of it among younger children increasingly? Well, I'm asking that there have been reports about the sugary drinks and meals that children are forced to consume
Yes.
by those in whose care they are.
Yes, yes, that's actually true. Especially you find these lifestyle-related conditions, because the gum disease and most of the dental conditions that we see, they are lifestyle-related. And you know, mothers and the parents nowadays, they are very busy. So they would rather have these very not so good food stuff to their kids just to make sure it's a quick meal so that they can be busy with their schedules. So you find, like you said, rightly said, that there is an increase, especially in children nowadays, because of the food stuff that we indulge. These highly processed, non-nutritious, sweet, and not so healthy food stuff, and there is quite a serious, actually, prevalence, especially in the young ones. Yeah, we see it nowadays.
Any final message that you'd like to leave the viewers with and the interviewer with, Doctor?
Yes, yeah. I just want to say that I know sometimes people, they are very afraid to come and visit their dentist. And we said that the mouth is the window, the gateway to your general body health. So for those that might be seeing like the red flags, you know, it's like a car. When you are seeing your warning light flashing on your dashboard of your car, you don't ignore it. Because if
Unless you do.
yeah, if you do so, it might be actually lead to something that is more expensive, maybe very not so easy and very dangerous, and sometimes it might be life-threatening. So it is with your oral health.
And you might only be left to the devices of one or two specialists in this country.
Yeah. So with your gum disease, if ever there is anything that you see, don't be afraid. Feel free, come and visit and see the right people with the right knowledge, with the right expertise. And if you come earlier, actually those most expensive and most likely life potentially threatening issues or conditions, you won't have to go through that.
Thank you.
Yeah, the earlier you come, the better is the treatment outcome and the less expensive it is. And that's my advice. Don't be afraid, just visit and come and get helped earlier.
Thank you so much for your time. Thank you for sharing your wealth of expertise so generously and altruistically, Doctor.
Thank you so much.
Dr. Ishumael Banda, one of our resident dental surgeons, talking to us about the correlation between the well-being of your gums and your holistic well-being. When we return, Nicole and I will tell you what to look forward to in the third and final hour of your most favorite show, Good Morning Namibia.